any procedure comes with certain risks of complications, meaning things may go wrong. And these can be a range of events and can be as minor as a little bit of pain more than expected to some temperature that will go away on its own, all the way to very serious complications that would require further surgery. With endometriosis surgery, there are risks, of course, and those risks are categorized in 2 or 3. One is the risk of having any surgery, like the risk of having an anesthetics, or risk of having clots in the legs and lungs. These are very rare, and to prevent clots forming in the legs and the lungs, we normally give our patients an injection to go home with to try and reduce that risk. Then there is the risk of injury to surrounding structures like the bowel, the bladder, the blood vessels, and the ureters. These can be very serious if not recognized during the operation, and if that happens, then you may need another surgery to fix things. The risk of that happening in my practice is in the order of 0.8%, so that is less than 1 in 100. But it can happen, and of course the more complex the surgery is, the higher that risk will be. Then we have things that can go wrong during admission. For example, you may not be able to empty your bladder very well, particularly after endometriosis surgery. That is something that can happen, but of course the nurses are there to make sure that your bladder is emptied, and you won't be sent home until they make sure everything is fine. We always send a very comprehensive letter that explains all of these risks, but make sure that you read that, and also to come back to us if you have any questions, you're not sure about what that means and you wanted to discuss things further.